Assalamualaikum warahmatullahi wabarakatuh dan selamat sejahtera. So hari ini saya akan buat recording untuk GI dengan kalau sebab kita buat terus untuk pankreatik lah. Okay. So saya share screen dulu. So first of all, minta maaf lah tak dapat nak buat kelas. Patutnya bila hari inilah kan. Okay. Tak dapat sebab ada hal sikit. Okay, so ni kita akan start lah. Okay, saya share screen. Okay, so hopefully you boleh nampak. So kita akan tengok bit on GI dulu ya, Gastrointestinal Disorder. So you all dah tahu dah berkenaan dengan the physiology of gastrointestine. I think you have learned on dekat mana? Dekat anatomy and physiology, isn't it? So kita pergi bit on detail more towards the disease lah. Okay. So by the end of this topic, you should be able to describe the clinical aspect, okay, of gastric and intestinal analysis, okay, to identify the disorder of gastric and also the intestine, okay, and of course the test for gastric and intestinal function. Of course, we need to know the test lah, because later on if you go to the hospital ataupun kerja ke mana-mana, so of course you need to know the test of the gastric and intestinal lah. Okay. A bit on clinical aspect for gastric and GI analysis lah. So kita panggil gastric GI gastrointestinal analysis. So it composed of of course lah, you dah tahu on physiology lah. Okay, until mouth, until intestine. Okay, and the secretion, okay, which occurs in response to various stimuli. Okay, some of them are neurologic impulse, of course from the brain, bila mana kita nak makan lah. Okay, lapar dah, perut dah terasa kan, so the gastric acid will be secreted lah. Okay, second, when there is a contact of protein breakdown products. Okay, ini contohnya adalah secretagogus. Okay, and this stimulation of secretion of gastric mucosa and also the gastric hormone. Okay, so these are the three secretion stimulus. Okay, stimulus for gastric secretion. Okay, kita tengok pada disease. Okay, so kita start of course lah daripada mulut ke intestine, right? So start with esophagus dulu lah. Normally from the esophagus. Okay. Of course, you have known the function of esophagus, right? So pergerakan of the food to the stomach lah. Okay. And normally for esophageal disease, say there are dysphagia, or they call it as a painful swallowing. Susah nak telan makanan lah. Okay. So why does it happen? Normally it is due to the cancer of esophagus lah. Okay, due to the cancer of esophagus. But it is an uncommon disease. Okay, but some of them ada jugalah. Okay, some of them contacted with the disease. Okay, and it will make the esophagus narrows the lumen, and of course dysphagia lah. Okay, and the obstruction will cause the vomiting for the patient lah. Okay. And of course, disebabkan tak boleh nak makan, dia akan inilah, okay, accompany with the weight loss. Okay. So this is whenever there is a metastasize lah. Okay, metastasis, the cancer will metastasize and we go to normally for through lymph vessel lah. Okay. Okay. And the cause for esophagus cancer, normally because of mouth cancer, metastasize to esophagus, and so these are tobacco and also the alcohol user. Maknanya tobacco tu macam bukan yang hisap rokok. Hisap rokok pun some of it will contacted with mouth cancer dulu. Okay, but normally tobacco, cua makan tobacco tu dulu lah. Okay, not I think nowadays dah tak banyak lah. Tapi sebelum ni, because of the chewing of tembakau tu dimakan lah kat tepi tu, so that will relate to esophageal cancer lah. So these are the major risk factors lah. Okay, mouth cancer, tobacco user, and also the alcohol user. Okay, so we go to gastritis. Okay, gastritis, there are acute gastritis. Okay, normally they call it as an inflammation of stomach due to irritant such as siapa yang ramai kalau dulu nak bunuh diri kan, so they eat lots of aspirin, makan Panadol banyak. So what will happen? Tak mati pun. So it will produce acute gastritis. Okay, excessive coffee pun sama, yang makan coffee, tobacco and alcohol, again those are the dia panggil major risk factor lah. Okay, or normally by infection lah. Okay, so these are the principal symptom: vomiting of blood. Okay, and to diagnose this kind of this disease, gastritis. Okay, so they will need a gastroscopy. Okay, gastroscopy lah to look at the inflammation in the stomach. Okay, and why does this alcohol as a major risk factor? Okay, it will stimulate the acid secretion and irritates the mucosa. Okay, second is peptic ulcers. Okay, tadi gastritis, now peptic ulcers. So lesion, okay, whereby necrotic tissue form a result of inflammation and slough off, leaving a hole to the peptic ulcers lah. So that's why they call it as an ulcers lah. So ulcer of the stomach and also small intestine, they call it as a peptic ulcers. Okay, ulcers of stomach and small intestine, so they call it as a peptic ulcers. Okay, and ulcers of the stomach are called gastric ulcers. Okay, tadi stomach and small intestine, they call it as peptic ulcers, and ulcers of stomach, they call it as a gastric ulcers. Okay, and some of the small intestine, they call it as a duodenal ulcer. Okay, so means that both are peptic ulcers lah, stomach and small intestine are peptic ulcers. Tetapi specifically lah, for stomach they call it as a gastric ulcers, and small intestine they call it as a duodenal ulcers. Okay. Okay, a bit on peptic ulcer. Okay, caused by pepsin. Okay, this is an enzyme. Okay, whereby it's being secreted by the stomach. Okay, and it is another one is hydrochloric acid lah. Okay, of the stomach, and also the intestinal juice. Okay, from bile duct also lah. Okay, and it will irritate the gastric mucosa. So ni yang menyebabkan berlakunya peptic ulcers lah. Okay, so normally irritated and also inflamed mucous membrane. Okay, akan menyebabkan berlaku necrosis. Okay, akan menyebabkan there's a hole lah. Okay, in the in the stomach. Okay, so some of them also has been infected by, they call it, this is one of the bacteria, Helicobacter pylori. Okay, H. pylori lah. So this associate whenever it does not be treated well, okay, ia akan menyebabkan ulcers lah. Okay. Okay, gastroenteritis and food poisoning. So these are some of the disease lah. So again, sampai ke gastroenteritis. Okay, again, this is an inflammation juga of the stomach and intestine. Okay, and these are the symptoms lah. Okay, anorexia, vomiting, diarrhea. So these are the normal lah. Kalau normal food poisoning, of course there are infection. Okay, infection by bacteria lah, or viral infection lah. Okay, so that will cause the food poisoning. Okay, so some other disease for intestine, small intestine normally absorption. Okay, it deals with absorption. Small intestine, right? Small intestine it deal with absorption. Mana apa yang dah di metabolize kan, so the final product will be absorbed by intestine lah. Okay, small intestine dulu. Okay, so large intestine absorb the remaining water and store the concentrated feces lah. Okay, so normally disease related to small intestine adalah diarrhea, constipation, okay, change of stool character ni intestine lah. Okay, intestine, bacterial small or large intestine lah. Okay. Okay, malabsorption yang ni related to small intestine. Okay, why? It is due to the inability of the intestine to absorb the fats, okay, and some other substance lah. Okay, so they call it as a malabsorption syndrome. So maknanya that small intestine tak dapat nak absorb lah, menyerap kan all those chemical compound, okay, other components lah, tak kira fat ataupun other substances. Okay, and what are the cause for the of malabsorption? Okay, berlakunya malnutrition lah. Why? Because tak boleh nak absorb kan, semua tak boleh nak absorb, so dia akan berlakunya malnutrition lah. Okay, and then of course related to that are the lack of energy, weight loss. Okay, so those are the results lah. Okay, so because of the tadi kan fat is not being absorbed by the small intestine, okay, it go to the large intestine and go to the feces lah. Okay, what will happen to the stool? Okay, it will become unformed, fatty, okay, and pale stools. So these are the results of accumulation of fat to the stool. Okay, okay, these are the fluids which is been released by gastric lah. Okay, GI, from GI. One is gastric fluid. Kenapa saya nak masukkan ni? Why? Because in measurement tadi lepas ni, okay, in measurement of peptic ulcers, of gastrointestinal, of GI, peptic ulcers, duodenal ulcers, semua tu. So dia disebabkan oleh, so these are the fluids. So these fluids akan digunakan in the diagnosis. Okay, so kita tengok bit on gastric fluid. Okay, of course, gastric fluid has a high concentration of hydrochloric acid lah. Okay, and pepsin also mucus. Okay, and analysis of gastric normally menggunakan bila mana in clinical medicine lah. Okay, ni it is used gastric fluid lah. Okay, gastric fluid measurement is being used to detect hypersecretion. Mana hypersecretion? Hypersecretion of hydrochloric acid, hypersecretion of pepsin, or hypersecretion of mucus. Okay, so normally hypersecretion is related to this disease, okay, Zollinger-Ellison syndrome. Maknanya secretion of hydrochloric acid, pepsin, and mucus is higher in this patient, this syndrome lah. Okay, and also it is being used to evaluate pernicious anemia. Okay, what pernicious anemia? Cuba cari balik. Okay, so tadi kan kita tengok on gastric fluid kan. So gastric fluid, kita tengok the gastric function test. Okay, normally there are gastric acid in basal and maximal secretory test. Okay, ada dua lah. One is basal, second is maximal secretory test. Okay, basal secretory dengan maximal secretory test. So in this test, of course, patient need to be fasting overnight. Okay, and 1 hour basal test. Maknanya before stimulation lah. Okay, before stimulation, so they will collect the gastric acid. Okay, to get the to measure the gastric acid lah. Okay, and then after that it will be a simulation. Okay, simulation by pentagastrine administration. Okay, by pentagastrine administration. So what will happen to the pentagastrine administration? Bila mana berlakunya pentagastrine administration, it will be the gastric acid will be secreted lah. Okay, will be secreted. So that's why 1 hour simulated test subsequent. So maknanya selepas pentagastric administration, 1 hour after that, so the gastric acid measurement were done. Okay, this is for maximal secretory test. Okay, so normally for test result, okay, overlap among healthy and disease, maknanya it's not specific lah. Okay, so for gastric peptic ulcer, okay, for gastric peptic, ingat gastric peptic ulcer tadi. Gastric peptic ulcer is in the stomach kan. So basal and maximal secretory test normally adalah normal lah. Okay, but for duodenal peptic ulcer dalam intestine lah, small intestine, there are increased secretion of both of them, basal and maximal secretory. Maknanya 1 hour before pentagastric administration pun dah tinggi, and 1 hour after pentagastric administration again tinggi juga. So that maknanya kita boleh detect. So means that the gastric acid for basal and maximal secretory can be used to detect again duodenal peptic ulcer. Okay. Second is gastric acid measurement. Tadi gastric acid at basal and maximal secretory lah. Now again direct gastric acid measurement lah. Okay. Again simulation, mana pentagastrin juga lah. Okay, pentagastrin. Okay. The ability of stomach to secrete against hydrogen ion gradient is determined by measuring the pH. So means that gastric acid measurement for gastric acid measurement after the pentagastrin, okay, pentagastrin tadi, dia akan detect the level of pH, okay, of the gastric acid tadi. So whether it high or low lah. So normally it will be lower lah, kan? Bila mana hypersecretion, terlebih secretion tu, so the pH will be lower, right? So total acid output, okay, measure from the titratable acidity and volume of the component specimen. Okay, gastric acid tu lah. Okay, and again, gastric acid is collected by intubation. Okay, maknanya the patient will be intubated lah. Okay, 15-minute collection in 1 hour. Mana 15 sampai 1 hour lah. Okay, so first 30-minute intubation discarded normally for of course to get the adjusted volume lah, normalization. Okay, but because normally bila intubation berlaku, again berlaku secretion juga, kan, berlaku secretion. So that's why 30 minutes intubation it will be discarded. Selepas tu baru akan dibuat measurement lah of the pH level. Okay, so that is gastric acid measurement. Okay, the third one is plasma gastrin. So plasma gastrin, gastrin dulu. What is gastrin? Gastrin is a hormone. Okay, untuk simulation the secretion of gastric acid tadi, yang belakang tadi lah, kan, gastric acid yang tadi. So maknanya bila mana berlakunya pentagastrin stimulation, kan, gastrin will stimulate the secretion of gastric acid. Okay, so in these diseases, tadi kan ingat pernicious dengan Zollinger Ellison tadi, so there are hypersecretion of gastrin tadi. Okay, so maknanya apa ni dalam plasma gastrin, which means the gastrin will be detected in the plasma. Okay, but it is not increased in simple peptic ulcer, which means simple peptic ulcer tak kira duodenal ataupun tadi apa? Okay, dah kenapa pula? Still in progress lah. Not sure what happened, so hopefully dapat juga. Sekejap. I'm gonna stop sharing. I'm not sure what happened. What happened here? You are sharing a screen. You are screen sharing. Recording on this computer. Let's share. Zoom share. Okay. Pause recording. Okay. Good. Good. Okay. Mana tadi? Okay. So we go to the plasma gastritis tadi. Okay. So for normal peptic ulcer, okay, it will not be detected lah. Okay. Maknanya plasma gastritis will not be detected in simple peptic ulcer, but for for hypersecretion, so Linga-Ellison in pernicious anemia, okay, it will be detected. Plasma gastritis will be detected. Okay, and fasting level for Zollinger-Ellison, normally it will exceed 1,000 picogram per mil and can reach 400,000 picogram per mil. And tengok normal range, only 50 to 150 picogram per mil of plasma gastritis. So ini menunjukkan a very high secretion lah. Okay, whenever a patient of Zollinger-Ellison syndrome. Okay. So tengok on macam mana kita nak tengok selain daripada all other measurement lah. Okay, other than those measurement, gastric acid tadi gastric acid of vessel and maximal secretion and plasma gastritis lah. Other than that, nanti kita tengok normally they will look at the clinical aspect. Okay, so normally it would focus on the evaluation of absorption and derangement of various diseases state. Okay, so these are some of the disease which related to intestinal function. Okay, so celiac, sprue, Crohn disease, ischemia, amyloidosis. So these are the disease which related to intestinal function. Walaupun it's not directly involved lah, but it is related to intestinal function. Okay, from that diseases, okay, some of the tests has been used, okay, dalam absorption lah, okay, dalam intestinal function, okay, to look for the evaluation of absorption, okay, and derangement of other diseases lah. Okay. Satu adalah for absorption test tadi, okay, absorption test, they call it as a D-xylose test, okay, D-xylose absorption test. Okay, what is D-xylose? It is a pentose sugar. Okay, it is a pentose sugar and it does not present in blood in a significant amount. Maknanya bila normal state tak banyak lah. It will be low at a very low concentration lah. Okay, and pentose sugar is absorbed, okay, unaltered. Maknanya tak diubah lah. Again, it's still a D-xylose lah. Okay, in paroxysmal small intestine, okay, and does not require treatment by pancreatic enzyme. Maknanya tak diubah lah, kan? It will remain the same. Pentose sugar will remain the same lah. Okay, for D-xylose. Okay. Sekarang ni we will look at the ability of the intestine to absorb the D-xylose. Okay, kenapa? To look for the malabsorption of intestinal and pancreatic insufficiency. Okay. Okay, sekarang ni what does the test first? Of course, the patient has to digest, have to ingest lah, makan lah, kena minum D-xylose sugar. Okay, and it will be metabolized by intestinal bacteria. Okay, and other will be excreted to urine. Okay, so to look at the absorption, how good is the absorption by intestine? Okay, is by the measurement of D-xylose in urine. Maknanya, if higher concentration, higher level of D-xylose, okay, dalam urine, which means measurement of D-xylose is done after 5 hours of ingestion of anilah by fasting adult. Level in blood. Okay, level in blood will be measured. Okay, level of D-xylose will be measured in blood. Okay, maknanya it will take the blood. Kenapa dapat di blood? Sebab kita nak tengok the absorption level of the D-xylose by the intestine lah. So which means kalau D-xylose tu tak absorb well by the intestine, okay, the concentration of the D-xylose, okay, akan tinggi lah, okay, akan tinggi dalam urine. Maknanya dia akan di-excrete out through urine lah, okay. By heating the protein-free urine and plasma to convert xylose to furfural, okay, and it will react with pre-bromoaniline, menghasilkan the spin product and measure absorbance at 520 nanometer. So this samalah yang you all buat selalu kan dalam lab lah, okay. So normal blood concentration associated with decreased urine excretion such as problem with renal function. Okay, maknanya sebab kenapa normal blood concentration associated with disease urine excretion? Maknanya macam ni. Decreased urine excretion. So maknanya urine is being the concentration of D-xylose is decreased in urine. Tetapi normal blood concentration tapi dekat blood it is normal. So what will happen? Maknanya dia still dalam circulation lah, okay, dalam circulation. Maknanya there is a problem with kidneys lah, okay, problem with kidney. Okay, so this is normal range in healthy adult lah. Okay, 4 gram in 5 hours period. Okay, blood level less than 25 milligram. Okay, milligram per deciliter after injection. So this is supposed to be normal. So maknanya kalau tinggi dalam plasma, okay, tinggi dalam plasma, less in urine, it indicated, okay, problem with renal lah, okay, problem with renal. So selain daripada D-xylose test, okay, other intestinal function analysis adalah lactose tolerance test. So normally yang ni for lactose intolerance patient lah, okay, and serum carotenoids to look for the fat soluble carotenoids lah, which associated with lipid absorption sama juga by the intestine lah, okay, by the intestine, lipid absorption. So maknanya berlaku malabsorption of lipid whenever the concentration of fat soluble of serum carotenoid is lower than 50 to 250 milligram. Other is fecal fat analysis. Okay, so this is an indication for steatorrhea. Okay, serum albumin menyebabkan this sign of intestinal disease compared with pancreatic disease lah. Whenever for serum albumin, maknanya low serum albumin lah. Okay, low serum albumin. Okay, so I think that's all for the intestinal disease lah. Okay, so just stop sini dulu. Saya akan buat second video lah. Okay, so thank you very much. Okay. So